Welcome to Beyond Rockets. Hope you're having a great day. My name is Clark Dunn and I'm your host. Get ready to enjoy some awesome conversations from Huntsville locals about cool work they are doing right here in the Rocket City. You can connect with us on social media at Beyond Rockets, and if you're interested in doing a podcast yourself, I'd love to hear from you. You can visit my website, beyondrockets.com today, or connect with me on LinkedIn at Clark Dunn. Sit back and enjoy this episode of Beyond Rockets.
Everything I liked except the way she talked to me every day.
This episode is sponsored by Yellowhammer Brewing. Yellowhammer is a local craft brewery serving Huntsville for the past 14 years. They are known for their premium craft beers like their T-Minus and Rebellion, but what you might not know is they also offer spirits, wine, seltzers, and non-alcoholic drinks. Next time you stop by their location, try one of their seasonal cocktails made with the Gemini Bourbon or the Yellowhammer Vodka. Or try this year's big hit, Pineapple Punch Seltzer. You can find out more information about Yellowhammer Brewery by visiting their website, yellowhammerbrewery.com, or visiting their tap room located at Campus 805. Well, welcome back to the podcast. Today I have the opportunity to sit down with serial entrepreneur, 20-year Army veteran, and current CEO of iXpressGenes, John Schmitt. Thank you so much for being here.
No, hey, thanks for having me.
Yeah, I'm excited. I think your LinkedIn experiences is pretty incredible. You've done a lot of different things, and even in the time you've been in Huntsville since 2012, you've done a lot of incredible things here in Huntsville.
Well, thanks for saying that.
Before we dive into talking about your time here in Huntsville and kind of the companies and organizations you've been a part of, talk a little bit about that 20 plus year career in the Army and kind of where that deployment took you.
Yeah, so I would say I had a very non-traditional military career. So I started off, so I graduated UC Davis, degree in biology, and then commissioned out of there. Went to, I was an aviator. So I went to flight school and then moved to Fort Campbell, where we had, I had my first deployment. And then I came back and was a maintenance test pilot. It's kind of where I learned, I really, really liked solving problems, and I liked technology in general. But the reason why I did that kind of sent me on my trajectory of kind of the schizophrenic career I've had is I was like, I didn't like the way we were supported by our maintenance folks, like when I was in that first deployment. So I was like, I'm going to fix that. I want to be part of that. So I became a maintenance test pilot and became a maintenance guy. So then went back for a second deployment and was a company commander of a maintenance company. And we got fielded some equipment on very we called the drive-by fieldings, to kind of during the peak of the war. And I was like, that system's broken. I'd like to be part of that one too. So eventually I would become an acquisition corps officer. And that's kind of what sent me on that trajectory as well. Actually, originally I tried to get out of the Army.
At what point in your Army career did you want to get out?
So it was after the second deployment. When I left that first deployment or that second deployment, left 2 days after my daughter was born. And it was a year long, and I realized, wanted to be with my family. I wanted to figure that part out. Unfortunately, I mean, I was approved to get out, and I was like, hey, this is great. But then my branch manager calls and says, hey, listen, we got this stop loss thing going. And so you're like number 10 on the list of 50 to come back to be individual augmentee in Afghanistan. And I was like, okay, I should probably just stick with what I'm doing. I enjoy it. And so I stayed in aviation. But I did get picked up for an appointment to go teach at West Point. And in order to do that, and this is kind of that weird part of my career, is I had to go get a master's degree.
Okay.
Something in science, because I was going to be teaching chemistry, life science. And, I scoured programs, and it turns out it was really hard to find a program that wasn't a PhD program. They were only going to do a 2 years master's. So I found a program at Vanderbilt, and I got a master's in microbiology and immunology.
So then you moved to Tennessee and did your master's there? Or
I did.
Okay.
Yeah. So we were at Fort Campbell, just like an hour down the road, so moved to Nashville. So I got this degree in microbiology and immunology. Never thought I would use it. Never thought it'd be appropriate, but obviously it's sent me on a path where I am today with immunology. So I went and taught chemistry for 3 years. I was ended up being a course director. Kind of funny story. I didn't think I'd be teaching chemistry, and I honestly hated chemistry. I was like one class ahead of my students.
You're like, I'll never teach this class. And
no,
now
exactly.
You're teaching it.
Yeah, exactly. I was like one class ahead of my kids. My students, but it was a really, really great opportunity because I also got to teach, some pretty high impact, classes like the morality of killing and stuff like that. Kind of sent me also on a path of philosophical path of healing towards my trauma.
Yeah.
But so I ended up, they asked me, I thought I was going to go teach biology the second year, and they're like, hey, we want you to be the course director. So every kid has to take chemistry at West Point. I think they've changed it since then, but so you had young men and women. They're going to be leaders, in the Army. They don't need to be hazed in
No.
in chemistry.
No.
So I basically re-wickered the program to be more of a program on scientific literacy, problem solving, and critical thinking. And that was a really cool opportunity because it made me really look at science and application, which kind of, again, like in just another little footnote in what got me to where I am today. Finished that tour. I was there for 3 years, left there as an assistant professor. And then I came here to Huntsville as an acquisition corps officer. And
had your tour taken, or your time in the military taken you to Huntsville prior? Or had you even heard of Huntsville prior?
No, had never been.
Okay.
Yeah, Alabama and I didn't have a real good start in the Wiregrass, so I was terrified to come back. But obviously, I immediately just fell in love with it. Actually, there's a song we wrote. It's called "Welcome Home." It's about that journey of coming, and just this place felt like such. It felt so welcoming, like an old friend.
Yeah.
It was so easy to fall into the community and fall in with.
And 2012 looked a lot different here in Huntsville. I mean, I Huntsville native, been here my entire life, so I've been able to see it. But even like 2012, like most people when I talk on the podcast that aren't from Huntsville have been here since right after COVID or right before COVID. But you've seen it, grow and become what it is today, and it's not slowed down at all. Like it's pretty impressive just to be a part of it.
I remember, that's interesting you say that, because I remember looking at, just kind of looking at the city and going like, you see folks 0 to 18 years old, and then you see folks, mid 30s to like retired.
Yeah.
And they were just missing this vital demographic of young 20 something, it's disposable income, and I was like, it was interesting because I was at Vanderbilt in Nashville just before it exploded. So it was there like 2007, 2008. I remember kind of feeling like this place feels a lot like that, right? There was just like the kind of the starting the conversations where you started seeing food trucks, you started seeing, outdoor festivals again. And you just started seeing these reverberations of like a youthful like resurgence. And that was cool. That was cool to watch. And then obviously where we are today,
it's incredible.
And
I think that's probably the biggest struggle for most organizations here in Huntsville is targeting that demographic of, hey, we were in college, or we're originally from here, or we went to college somewhere else. We have just graduated, and we're in that early 20s, mid 20s range, under 30. Getting them to come here, because I feel like for the most part, most of the people I graduated high school with, their desire was to never come back to Huntsville. And I feel like that was the testament for most people. And on the complete opposite, I never wanted to leave Huntsville. It was familiar. It was one of those things that like, I don't think even in 2012, you could have imagined what it is today.
Yeah.
But I think in the last few years, it's like, well, the sky's the limit. Did your entrepreneurial journey start when you came to Huntsville, or have you had an itch for entrepreneurship prior to your time here in Huntsville in 2012?
With one of my friends from the Army, we started a nonprofit called the Wainwright Foundation. That was kind of I think probably the first shot at it. It was a dumpster fire. We tried our best. I think we had like one little fundraising thing where we had like a scholarship, essay scholarship, but the foundation of it was really cool. And that's kind of when I realized like, it takes much more obviously than just an idea and hope. It's a hustle. It's networking. It's a community. It does take so many pieces, and more importantly, seeds that you've planted over decades.
Yeah. And so as you came to Huntsville, talk a little bit about that first venture that you started to kind of like showcase local music here in town.
Yeah. So, it's all connected. So I started songwriting with my best friend, Alan Little, at the time. Our daughters were itty bitty at the time, and we're best friends, and we started writing music together. He'd had this vision of bringing together local musicians and kind of showcasing the talent. And, to give you an idea of the time frame, 2012, there was the the desire for aesthetics and art and whatever was definitely a different place than it was today. There's kind of this assumption that, art should be free and musicians should play for free at the restaurant because, they.
Yeah, I think it is one of those things that it's, hey, if we're willing to ask you to come play, you should do it for free.
That's right. And it was a very frustrating thing. So what we try to do is we kind of built this community. It was a platform really to showcase, not just showcase musicians to the community, but kind of more importantly, like share with the musicians that there was a community here and it was worth staying here. Right. Because they were
and like that was so early into this idea that Huntsville can be a music city. Like,
agreed.
I how difficult was that to like, I just imagine trying to coordinate with artists at that time here in Huntsville.
It was not, I mean, there is so much talent here, so much original music, original talent. And it was awesome. I think we did over 20 shows over 5 years.
Wow. And where were your shows typically at that time?
So we started at like the VBC Playhouse.
Okay.
And then we really kind of found a niche, at Tangled Strings over at Low Mill, Danny Davis's shop. COVID, changed that dynamic because he went to full-time production and well, COVID changed everything for us. We had to shut it down.
Yes.
But we did a lot of it and it was a very, very intimate kind of listening room experience. And that's kind of where we changed it to, where it was a very, musicians in the round, but then they would explain their songs and where it came from. And it was very kind and very intimate. And it was, I think we successfully achieved our mission of, introducing musicians, but also letting these musicians know that there is a home here for you.
Yeah.
And then, COVID hit and obviously changed a lot of dynamics. We were really excited to be part of that. We think, we were definitely ahead of the curve, when the amphitheater came and Ryan Murphy and his folks, like we connected with them early on. And actually it was RCP companies that bankrolled we did a international songwriting competition.
Oh, wow.
Which was a lot of fun.
And it was really cool.
And it was to celebrate the 50th anniversary of the moon landing.
Okay.
And, so like the growth of like RCP and Mid City and then the amphitheater, like
was all in conjunction to what you were doing, which is, and like now, like,
it was a lot of fun to be just kind of part of the early stages of that.
For sure. And it's like now Mid City RCP companies and the Orion. I mean, like it's become a staple.
Oh, it's
not even just in Huntsville. It's become a staple in the country.
I totally agree. And we recognize like COVID was probably a gift, right?
Yeah.
I mean, we got eclipsed
for sure.
But at the time, I think for what we were trying to do it was such an impactful and we were just honored to do it. It was so much fun.
And then, so you had, with COVID, this kind of dissolved, but then shortly after COVID, 2021, 2022, I guess you started the advanced manufacturing or were a part of that. Talk a little bit about that. Cause I mean, it seems a little bit of left field from songwriting. I don't know how much of that is in advanced manufacturing, but maybe. So how did that come about and kind of what was the driving force and the factors that kind of accompanied that? Yeah.
So I was approached by the leadership of the National Center for Defense Manufacturing Machining. And they wanted to stand up a nonprofit here in Huntsville that was able to kind of service the DoD customers and also work with small businesses because their kind of core purpose is really is to like take advanced manufacturing and deliver it to small businesses and to the DoD so that we can reduce costs, reduce price, reduce or increase quality control, all that stuff. A lot of cases, especially in the DoD, we design the prototype and then you go to production with a prototype. It is much to the chagrin of, the taxpayer, to the warfighter. But it's kind of an intentional business approach by some of the bigs that, if they have to constantly product improve and maintain it, it's where a lot of their profit comes from on the product line. So, I learned as an acquisition core officer early on just how backwards that system was. And it's very frustrating. My last program was the Schmitt program. And essentially, it was a poster child for why I wanted to do and continue to serve the community in the role of AMIC was the Chinook helicopter is a phenomenal platform, but the Block 2 program was essentially stuff we should have done 25 years ago. 3 years and $1 billion, and we didn't fundamentally increase capability.
Wow.
You reset it to be a platform that would continue in the future. At the same time, you had a company like Blue Force Technologies that took a completely clean sheet to first test flight of an electric vertical takeoff and landing aircraft in 13 months.
Wow.
So you talk about it's not a technology issue, it's a culture issue. So to stand up something here in town when the most expensive commodities the DoD purchases, aviation and missile systems, we have a true opportunity to reshape how defense acquisition works and how to influence it so that manufacturing is thought of earlier. For us to adopt concepts like digital engineering, it's an imperative. We absolutely have to do it. We can't afford to spend 25 years developing weapon systems for adversaries to steal the tech data and then optimize it for mass manufacturing and government subsidized labor. And they can make 400,000 of something we can afford to buy 20 of.
Wow.
We have to change this paradigm.
Yeah.
So for me, that last 10 years in the acquisition corps was really like an eye opener. Like, okay, this is something I'm really passionate about. I'm a patriot at heart. It's really important to me. National defense is very important. Like, this is a place where I'm very passionate about. And then what I've found is if I'm passionate, I can generally, add value. So to be able to stand up that organization and do that for 3 years where we, helped with workforce development too, because it takes a whole workforce, a modernized workforce to tackle these problems in a different way. It's not throwing shade on folks, but when you design weapon systems like we did 25 years ago, and we're manufacturing them like 25 years ago, to just say, hey, we got to do it differently is a very hard.
Yeah. Easier said than done.
Very difficult.
Yeah.
So, it really did take, somebody like us as a nonprofit, as a trusted partner. Like, we're not here to make money off this or advocate for a certain solution. We just wanted to, help modernize our workforce and, provide access to a national network of solution providers, with the sole goal of solving a tough problem. So, I mean, it was, it does seem a little different than music, but it was a natural transition kind of the military, an opportunity for me to continue to serve in a meaningful way.
And I think like you mentioned, if you find something that you're passionate about, that you have the expertise in, or that even if you're not only gonna have the expertise in, but you're at least passionate about it, it seems like your mental fortitude to make that idea a reality has boded pretty well in your career so far. And so it's pretty, I think that's how I originally met you, was when you were at the advanced manufacturing.
Oh yeah.
I was helping with I was helping with co-working night, and they were we got introduced to each other, and we met at Charlie Foster's, had coffee, and then we went back to the facility, and I saw it, and I think you had just maybe moved in because there really wasn't anything in it yet. You were kind of like showcasing where things were going to be and like what you were going to do. And I remember thinking like, this is going to be pretty cool. And then now kind of seeing sort of that growth it had, and then your transition out of it to what you are doing now with iXpressGenes. Talk a little bit about how this technology and the other co-founders kind of approached you, and how this idea to test for PTSD kind of came about.
Yeah. And, it's a really powerful story, and it's rooted in like one of, Huntsville's biggest tragedies. There was the mass shooting at UAH in 2010. And Dr. Ng was, they were having a staff meeting when she came in and killed 3 people and, just wreaked havoc on that entire department. Dr. Joe Ng, the founder, he spent the next, year just observing this spectrum of resilience among the folks, the survivors of that shooting. And he just, I think we all have this inherent understanding of people who have experienced intense trauma. There's illness associated with it, and it's not just anxiety and depression, but there's illness, right? Like, in little known fact, it's you're 5 times more likely to have ALS and MS if you have PTSD.
Wow.
Sexual assault victims are much more likely to have rheumatoid arthritis, Crohn's disease, like you name it. There's a whole myriad of diseases that go along with it. So he had this thought and this idea that there was an immunological component to trauma. And so he got a small grant, and he had about 100 veterans screened for PTSD, and then took a whole blood sample. And we did, so Joe's, his life work has really been in RNA. Folks, are focused on DNA, and that's absolutely critical as far as, the dogma of biology. DNA makes RNA, makes protein. He's looking at RNA, and the reason why RNA is because if it's currently being made, it's currently doing something, right? If it exists, it's doing something right now in your body. And what we saw was dysregulation in a very specific pattern among over 90% of those individuals that were in 0% present in the control population. So fast forward, I met Joe. I guess it was 2018. Actually, I came here to Hudson Alpha, and he gave me a tour, and our good friend Peggy Salmon had introduced us. And we had, he almost as an afterthought, and this is how I remember it anyway. He's like, "Hey, you're a soldier, like you'd be interested in this." And this is years later. This is, and he showed me this slide deck, and we just said like, what's going on with this? And there was kind of this thought that, the sample size was too small and it wasn't really worth publishing. And we said, I'm like, Joe, we got to do something with this. And so at the time I was on the board, and still am, on the board of Little Orange Fish, mental health nonprofit here in town. And we did some fundraising, and we, with Dr. Ng's connections and, folks here at Hudson Alpha, we built this research collaborative. And we really furthered the research. And, fast forward today, we just finished a blind study with Wellstone, where, we have 0 false positives, and we had 1 false negative. And the false negative actually turns out to be a pretty important discovery, because you can tell the difference between a neurological depression versus a trauma-based depression. So, I just, seeing this as a project initially of just like, hey, we got to further this research and see where it takes it. We worked with Wellstone, and we realized that we have a clinically helpful product. And it's, we're now getting through regulatory approval. We will be able to offer the test in 2025, commercially. And we have a lot of political support with our delegation and with the Veterans Administration. We have a ongoing clinical trial down in Birmingham, but on a national scale, we've got support for a national multi-site trial, which we're hoping to see come to fruition here in the next few months. It's been a pretty incredible journey, and it really is an honor to be able to serve survivors of trauma. And the one thing that I'll say is just to clarify what this is, right, is we're not diagnosing PTSD. There is a very good analogy in a cholesterol test, right? So the 1980s, people thought you couldn't prevent heart attack or stroke or heart disease. It's the number 1 killer. And of course, we now have this simple biochemical test that we all take. Every one of us takes every year, that allows for early intervention that prevents heart disease. PTSD is created by an autoimmune disorder against our own stress. And we have a simple biochemical test that allows for early intervention that will prevent it before the disease state occurs. So, we don't prevent PTSD, or we don't diagnose PTSD any more than a cholesterol test diagnoses a heart attack. It shows the state of your body that if you don't figure out a way to manage your stress properly, you will have poor outcomes.
Wow. And it's that TAI screening that y'all are doing that has that early detection.
Yeah. So we call it the trauma autoimmune indicator.
Okay.
Yeah. And so what it really is it shows current dysregulation in a very clear fingerprint to show that, like, really, from a patient standpoint, obviously from a provider standpoint, it's a little more complicated, but from a patient standpoint, really it's kind of a stoplight, right? Green, hey, listen, you're managing your stress well, like, hey, great job. Whatever you're doing,
keep doing it.
Diet, exercise, life choices, you're doing a great job managing your stress. Yellow, hey, there is chronic inflammation present that's indicative of trauma or, unresolved trauma or stress. And if you don't do something about it, it will create poor health outcomes. And then, excuse me. And then there's the red, which is, hey, you not only have acute and chronic inflammation present that is due to stress and trauma, but it is currently causing disease.
Wow. And it's incredible just to think that, the amount of people, I think when most people think of PTSD, they think of people in the military.
That's right.
But you also have referred to it as trauma, and you've alluded to some of the other traumas that can be tested, or that kind of is supported by the research and the technology that that you're a part of. Talk a little bit about some of the other areas of trauma that
Yeah.
iXpressGenes can kind of help detect.
Yeah. So, we have to completely relook PTSD. I mean, we have to just completely restructure it in our brains. We've lived 20 years during the war on terror. We think we know what it looks like. But we actually internally, we don't refer to it as PTSD. We refer to it as trauma-induced disease, because it's not just the anxiety and depression, DSM-5, diagnosis. It's all this other stuff. It's human disease that's created through trauma. 82% of PTSD costs in this country is not veteran related.
Wow.
It's a $230 billion problem in America alone. It's about $1 trillion worldwide. I mean, 7%, 7 to 12% of the population has a PTSD diagnosis. And so, I mean, we're talking about a problem that if we can get in front of, I mean, the avoidance of human suffering, if we can, and more importantly, if we can intervene just 3 years early of what would have been a PTSD diagnosis, we estimate we can save about $500,000 in healthcare costs per person.
Wow.
Yeah. So that data comes from a pretty enormous study, about 58,000 medical records. The fascinating part of that is the majority of that cost is not mental health related.
Wow. And I think, I mean, that's one of the, I like just trying to wrap my head around just how much of an impact iXpressGenes can have, not only in the state, not only in the country, but in the world.
Yeah.
What was that journey like from that initial conversation in 2018 about this? You come here, you tour, you learn about it for the first time, to then now in 2024 October, you were appointed as CEO. Like, what was that journey like to kind of just casually get involved to now being really involved?
You asked me about, my military career and this path. And I mean, I think even doing the music stuff and learning how to set up an LLC and do billing and invoicing and, insurance and, I think all of that stuff, and then getting a degree in immunology that I didn't even know how to spell it at the time.
Yeah.
I think it has all come to a culmination where this is where I'm supposed to be. I'm incredibly grateful for the journey I've had. And I've always it never made sense, right? Like I would explain my career, and it's just super weird, right?
Yeah. It's like is this like, are you quoting a story? Like, is this a
Right?
movie, or is this like what you actually experience? Like,
Yeah,
no, like this has been my life.
It is literally like ADHD in a resume, and so, today, if I look at it holistically, it's all set us up, to be able to be successful with, between, I don't need to be a scientist. We've got great scientists, but I can understand it enough to be able to sell it and see that commercialization, the commercial opportunity. And then, being able to stand up a business, an organization that eventually became, profitable. Like I understand how to build a team and to build the network and the coalition. And then, I mean, my time, in the acquisition core, and even since then, with being able to work with, our members of Congress and lobbyists and, help influence policy, like all of this stuff has come to a place where I truly feel like I'm exactly where I'm supposed to be. And it is the great honor of my life. And, I loved working at AMIC because it gave me an opportunity to serve beyond uniform. I mean, this is what thing I want to do the rest of my life.
Yeah. And it's crazy to think. I don't know. I mean, like you said, you've done a variety of things, but in 2012 is when you first got approached or came to the community of Huntsville. and just thinking through the amount of people you've been able to work with, the amount of people you've been able to meet
Yeah.
that have, kind of laid the groundwork that at the time you had no idea what it was going to actually impact you in 2024, 2025.
That's right.
But, you wouldn't have been here. And now you get to lean on them for things that you're doing now with iXpressGenes. As we're recording this beginning of 2025, the year is upon us. We have a lot of incredible things, it sounds like, that are in store for iXpressGenes, and you've alluded to some of them. Talk a little bit about what you kind of see 2025 looking like for the company.
Yeah, this is our year. I'm saying it in a very calm way, but I can't tell you how excited I am. It is pretty amazing. Right now we're sitting on over $12 million worth of letters of intent of customers that say, hey, we would like this product. And that is so rewarding because it just tells us, that there's this demand. And more importantly, there's an opportunity for impact. So this year, a lot of folks, kind of looked at us and were like, well, you're a decade off because you got to do FDA approval and this, that, and the other. And no, we don't. We have to get lab developed test status to allow us to do testing here at our lab. And we're well on our way for that. Like, we should have that in the next 30 days,
Wow.
Which is phenomenal, which means we can offer this test, commercially, in the state of Alabama. And then we just build out with states that have reciprocity, with CLIA approval. And so we really are like going to start building a company that gets to like deploy this technology across, we're starting with direct primary care health systems, because they're cash pay. I mentioned that I mentioned that blind study. That blind study we felt was enough to get us favorable to get a favorable reading on a FDA breakthrough devices status. So we just applied for FDA breakthrough devices status. We think that we'll get an answer in the next 30 to 45 days. That will allow us a fast track for Medicare, Medicaid, kind of get handheld through that process, but then also full FDA approval. We can process probably 1 million tests here a year, which is a ton of bandwidth. But the real opportunity for impact is to be able to license it to the folks that do this better, right? LabCorp, LabQuest, the major lab systems, major hospital systems. Us as a little company here in Huntsville, like we don't need to recreate international logistics.
No, you just got to partner with people that already have that infrastructure.
That's right. So we know that there's a market. We know that there's a demand. The conversation couldn't be more forefront right now. Our elected leaders are incredibly frustrated and challenged with, not meeting the needs, mental health needs of Americans in general, and the costs are soaring for mental health. I think we're perfectly seated at the right time, at the right intersection of American history, where we have a product that solves an enormous problem that will impact human health and lives.
Yeah. And so like as people are listening to this early February, March theoretically will be a time where that service can be provided to people in Alabama.
That's right. Yeah. So we are only going to be providing to service providers.
Okay.
So because we are not mental health professionals, we are not physicians. We need that continuum of care to be developed and provided by a professional, right? So for folks that are interested in this test, they just need to go to their provider, either mental health or primary care physician or whoever, and just request our test.
Wow.
And we have two ways of doing it. So with partners that have their own on-site phlebotomy, it's just another vial of blood like you get with your annual physical, right? And then they ship it to us. We provide the results back to the provider. The other version of that is a provider can order a test and it gets shipped to your house. Wow. It's a simple test. It's a little button that you click and you get a 1 milliliter vial of blood and drop ship that back to us. Then we provide the results back.
Wow.
So, and you're starting to see that business model in a lot of kind of niche testing, whether it's cortisol or, I think 23andMe was probably the first one to do it in mass.
Yeah.
But like that model's pretty well established, and we're just kind of fall into that that opportunity too, where
Yeah.
we don't need to build a fancy infrastructure to do it. Just ship it to your house and do it. And we can provide the results.
Awesome. Yeah. And I mean, I think we'll be sure to have everything in the episode notes. So any links to stuff that y'all are doing, news releases, any, if you're listening or watching and you want to find out more information, all those links will be there. But I feel like we're going to have you back on the podcast in a couple of years. Cause I feel like I feel like 2025 is going to be, like you said, a pretty impactful year for iXpressGenes. And I'm looking forward to seeing the impact you'll have, not only in the state of Alabama in the next 30, 40 days, but in the country and then everywhere else. I mean, I think it's pretty impressive just to see your journey here in Huntsville.
Thank you.
Prior to Huntsville.
That's very kind.
And then thinking now that, all this is it's kind of cultivated to this moment. And now you're being able to kind of fulfill a need that it impacts many people. So I appreciate you being here today, and we'll be sure to have you back on in a couple of years.
Thanks so much for having me. It's been a lot of fun. Thank you.
Thank you so much for listening to this episode of Beyond Rockets. Don't forget you can subscribe to the podcast wherever you listen and on YouTube at Beyond Rockets. Be sure to follow me on Instagram at Beyond Rockets to stay up to date with new episodes as they are released. Thank you so much for listening, and I hope you enjoyed.